I'm Mary Montoya.
I'm Simone Wilson.
And I'm Elizabeth Gorney, and today we'll be presenting our research findings on the relationship of green tea consumption and the risk of esophageal cancer.
First, we begin with a little background information on green tea. Green tea comes from a family of flowering plants known as Theaceae. The genus of green tea is the Camellia, and the specific species is the Camellia sinensis. Camellia sinensis is a species of plant whose leaves and leaf buds are used to produce Chinese tea such as white, green, black, and oolong. Cultivation of green tea originated 4,000 years ago in China and India. Many countries throughout the world consume green tea, with high consumption in India, China, Japan, and Thailand. The average cup of green tea contains about 20 milligrams of caffeine. The medicinal properties of green tea are known as polyphenols. Polyphenols are antioxidants that can neutralize free radicals and may reduce the damage they cause. They also have anti-mutagenic effects. The specific polyphenols are called flavonols. The major catechins in green tea are EGCG, EGC, ECG, and EC. Catechins from tea are what seem to provide the health benefits.
Green tea has been marketed to improve the following conditions: cardiovascular disease, diabetes mellitus, depression, weight loss, and cancer as a protective antioxidant. Since green tea contains caffeine, those individuals that are pregnant and breastfeeding suffer from anxiety disorders, sleep disorders, irritable bowel syndrome, and heart and liver kidneys may be advised not to consume high consumptions of green tea.
Some of the drug and nutrient interactions seen with consumption of green tea includes blood pressure medications, anti-anxiety, antidepressant, and antipsychotic medications, chemotherapy medications, folic acid and iron, and anticoagulants. It's thought that the caffeine in the green tea is what interacts with these drugs. Some toxicities seen are high doses of oral green tea extract and catechins have been found to be toxic to rat livers. Daily doses of 800 milligrams per day of EGCG capsules for up to 4 weeks have been found to be safe and well tolerated. 70% of green tea is imported to the United States from China, Japan, and Canada. While green tea is usually brewed and drank, other uses include the pill form and, in the skin product, Proactive, used as a green tea moisturizer. Current recommendations for the following diseases, cardiovascular disease, diabetes mellitus, and obesity, have been found that these levels of catechins, 400 to 760 milligrams per day, show a benefit for cardiovascular disease. 3 to 5 cups per day provide 250 milligrams of catechins. So in order to provide this amount of catechins, 400 to 716, to show the benefit for cardiovascular disease, we need to drink about 6 to 10 cups a day of green tea.
Our first article we will present is entitled "The Phase 2 Randomized Placebo-Controlled Trial of Green Tea Extract in Patients with High-Risk Oral Premalignant Lesions" by Teoso et al. This study was a 12-week study, randomized control, that assessed the effect of green tea extract with patients with oral cancer. There was a total of 39 participants, of which there were 14 patients with prior head and neck cancer history, 11 of whom had a prior oral tongue cancer. The remaining 3 patients had a prior history of larynx cancer, base of tongue, and tonsil cancer. All 4 arms were similar with respect to distribution of patients with prior history of head and neck squamous cell cancer. There were 4 groups. Green tea extract was given in an oral, in 500 milligrams, 750 milligrams, and 1 gram, and 1 placebo group. 39 patients were evaluated for the 12 weeks. The clinical response rate was higher in the combined green tea extract arms versus the placebo. There was a histological response rate of 21.4% versus 9.1%. The clinical response rate was dose-dependent. There were no associated The clinical response rate showed no association with the decreased risk of oral cancer.
Our second article, Food Intake and the Occurrence of Squamous Cell Carcinoma in Different Sections of Esophagus in Taiwanese Men by Chen et al. Their objectives were to test the effects of diet, temperature, food and beverage, and its effects on the upper, middle, and lower esophagus. Half the population tested had squamous cell carcinoma, the other half did not. The population size was 1,098 people, and its class of evidence was C, meaning it was a case control study. They studied unfermented tea and mixed tea, which is just a mix of fermented teas. And the results showed that certain diet components may affect local and systemic carcinogenesis with an odds ratio of 0.5 for unfermented tea and a confidence interval of 95% between 0.3 and 0.8. And 0.6 odds ratio for mixed teas with a 95% confidence interval between 0.4 and 0.8. The p-value is less than 0.05, so it is statistically significant.
Our third article was a 1994 population-based case control study done in Shanghai, China. This article was titled Reduced Risk of Esophageal Cancer Associated with Green Tea Consumption. This article was a class of evidence level C and included a large sample size of 2,286. The objective of this study was to evaluate the association between green tea intake and the risk of esophageal cancer. This table shows the results of the study. Women were found to have an odds ratio of 0.50 when adjusted for confounding variables. This result was statistically significant with a p-value of less than 0.01 and a 95% confidence interval. Men and women who were non-smokers and non-drinkers both showed a statistically significant reduced risk of esophageal cancer when supplemented with green tea, when evaluated for green tea consumption, with men with an odds ratio of 0.43 and women with an odds ratio of 0.40.
Some of the listed limitations for Article 1 was the biomarker was not validated. The limitations associated with Article 2 was the FFQ, the food frequency questionnaire, was not verified, and an underestimation of intake of recall bias due to study design.
Multiple comparisons could also lead to a type 1 error. In Article 3, some of the limitations were that it was a case control study design, which is not really one of the stronger study designs, and it was based on association only. So it was not definitive and maybe not reproducible. This is our grade of overall evidence for the project. We gave the studies as a whole, the quality we gave limited weak. We only found one randomized controlled trial, and the rest were all case control studies, so they fell in this range. We gave consistency a fair. Most of the studies found about the same results. And the quantity we gave fair because there was only one randomized control trial, but there were large sample sizes. Clinical impact, the grade was not assignable because there's more research that needs to be done to give any type of grade for this. Generalizability, we gave a limited or weak grading because it was limited due to the narrow population studied. Most of our studies were done in Asian populations, so we can't generalize this to the United States or the entire world. Overall grade of our project, we gave a grade level 3, limited weak. And these are some of the reasons. There were weak designs, mostly just case controls. As we have said before, only one randomized controlled trial we were able to find. Results were inconclusive. There was a narrow population used, and however, there was a large sample size.
The most recent pronouncements came from the FDA, and they found that systematic studies are inconclusive to support the risk of breast, prostate cancer, and other cancers. And existing evidence does not support qualified health claims for green tea consumption and a reduced risk of any other type of cancer.
At this time, there's not enough evidence to support that the consumption of green tea will reduce the risk of esophageal cancer.
These are our references.
Thank you.
Shoot me.